All right, so with me, I have Dr. Rani Banik, who is a board certified ophthalmologist and fellowship trained neuro-ophthalmologist with additional training in functional medicine. So, Dr. Rani focuses on the root cause of eye diseases and uses integrative strategies for conditions such as thyroid eye disease, macular degeneration, cataracts, dry eyes, glaucoma, as well as other diseases of the visual system. And our treatments are based on nutrition, botanicals, lifestyle modification, essential oils, as well as supplements. And Dr. Rani runs a private practice based in New York City in Manhattan. And thanks for joining us, Dr. Rani.
Thank you so much, Dr. Ozansky. I really am happy to be here. Thank you.
Yeah, same here. It's a great to chat with you again. And so we're, of course, going to cover thyroid eye disease. And so why don't you start out by briefly discussing what thyroid eye disease is?
Sure. So, thyroid eye disease is an autoimmune disease. And what happens is the body creates antibodies against tissues within the eye socket. So, we know that in autoimmune diseases, the body can attack any tissues, but here specifically, it's attacking receptors found in the soft tissues of the eye socket, in the fat, in the muscles of the eye socket. And what ends up happening is that there is an inflammatory response, and there are certain signs and symptoms that we can talk about that develop because the body is attacking itself. And thyroid eye disease can occur. The majority of people who have thyroid eye disease have Graves' disease. About 90% of people with thyroid eye disease or TED have Graves' disease, but it can also occur with hypothyroidism, for example, Hashimoto's. And sometimes people are even euthyroid, meaning their thyroid is functioning just fine, but they have autoimmune markers that are attacking the eye socket. So it can occur in the entire spectrum of thyroid disease, but in some form of autoimmune activation.
All right. So you said it can occur in like Hashimoto's. So percentage wise, probably I think it's like maybe like 80, 90% of cases of thyroid eye disease is in those with Graves' disease. Does that
Yes,
sound
yeah.
correct?
The vast majority have hyperthyroidism from Graves' disease, and then the minority have Hashimoto's or are euthyroid.
Okay. Can you discuss some of the, well, why don't we talk about the stages? There's different
Mhm.
stages of thyroid eye disease. So if you could jump into the different stages that one can expect to experience.
Sure. Well, it's very easy, actually, the stages. There are two main stages. One is the active stage of the disease, and then there's the inactive stage of the disease. And the active stage, that is the acute inflammatory stage. And it usually lasts about anywhere from 6 months to up to 2 years when there is a lot of congestion. The inflammatory cells, both B cells, T cells, get activated. They cause swelling, they cause redness, sometimes pain, discomfort. Again, that is all the active stage of the disease. And then in the inactive stage of the disease, which happens usually after 2 years of onset, people don't have as much of the congestion, the redness, but they can certainly have puffiness, they can have swelling, they can continue to have some of the other symptoms of the active stage. For example, I didn't mention this earlier, but double vision can persist into the inactive stage, and other things like dry eye can even persist. So that's the main way to categorize it. And there's not a clear cutoff when somebody transitions from the active stage to the inactive stage. It's not like a sudden change. It's kind of a gradual change that happens.
And I know it varies, but on average, how long does that first stage, that active phase last?
In my patients, I would say the average is about a year, sometimes a little bit longer that it persists. But usually, again, after 2 years, it does kind of transition into the inactive stage. The first 6 months are usually the most dynamic. That's usually when the majority of the inflammation is apparent. And that's when the patients are most symptomatic in the first 6 months.
Okay. And then, so with once someone is in the inactive stage, are they permanently in the inactive stage, or can they revert back to the active stage? Have you seen that at
Great
all?
question. I have. So it's in the a very small percentage of patients where they can get reactivated, and usually there's some kind of a trigger, whether it be actually it's the trigger that I've seen most often is stress that can trigger it, or exposure to certain types of toxins, or perhaps they've been ill, perhaps they've had some other illness, chronic illness, and then that triggers it. And then many of thyroid patients, because it is an autoimmune disease, other autoimmune diseases may coexist. So let's say they have thyroid, but they also have something else like lupus. If their lupus flares up, then it's much more likely that their thyroid eye disease is going to flare up as well. So that's something just to watch out for, that these flares can sometimes happen together. But the vast majority of patients, and fortunately, this is fortunately, once they go into that inactive stage, they remain inactive. So what I tell my patients is this is a long journey. It can be very frustrating, having these symptoms. They affect your function. They can affect your appearance, and people are really, very disturbed by all of these changes that are happening that they seem to have no control over. But what I tell them is you have to hang in there. And there is no quick fix for this. And eventually things will get better, but it can take a couple of years before things really start to get better.
And if someone does need surgery, they do need to wait into that inactive stage. Is that correct?
Well, I base it off of, when someone is a good surgical candidate, or whether it's appropriate for surgery or not, I base it off of their lab work. And first, their thyroid has to be stable. So if their thyroid values are still fluctuating, going up and down and up and down, that is not the opportune time for surgery, because that means that their eye changes could also be fluctuating. So even if you think that, your eyes are stable, but your thyroid is still all over the place, you cannot have surgery. It's really not a good idea. And then once the labs have stabilized, then I wait another 6 months to make sure that the eye findings are stable before recommending any kind of intervention like surgery. But in the meantime, there are so many things people can do, which hopefully we'll talk about, to really try to ameliorate some of those symptoms rather than going the surgical route.
Yes, we definitely will discuss some of those things that they could do. Now, you mentioned stress, so where stress could be a factor getting into, if someone's, even though it's rare, if they're the inactive stage, they could potentially still revert back to the active stage. So, as far as just triggers in general, so you mentioned thyroid eye disease, autoimmune. So, I imagine the same triggers as that you see with Graves, Hashimoto's, and lupus and rheumatoid arthritis. So food, infections, chemicals. Is that correct?
Absolutely. Infections, viruses in particular. I've seen patients flare up after viruses. Again, not common, but it can happen. Stress, meaning lifestyle kind of habits. So when people don't sleep well, when they're not rested, when they're not eating on a regular schedule, when they're eating inflammatory foods, all of those can be triggers. And then toxins. We know that the biggest toxin exposure risk for thyroid eye disease is smoking in particular, but any kind of air pollutants, toxins, for example, even cooking fumes. I've seen, I have some patients who are chefs, like professional chefs, and they do know that when they're really, if they're not wearing their eye protection when they're cooking, then their eye symptoms tend to flare up. So these are just all things that are under your control that you can modify, that you can, through which you can reduce your risk. So it's just really important to be aware of all of these lifestyle factors, these modifiable lifestyle factors.
All right. And is it safe to say if someone has Graves' disease with thyroid eye disease, since it's very common for people with Graves to have thyroid eye disease, that the triggers will be the same, like whatever's triggering Graves is triggering thyroid eye disease? Or do you find that it might be separate, like where for Graves, maybe and I know it's difficult to tell too, sometimes you can't always tell, but would you say that I mean, in my opinion, I would say there's overlap. If someone like the same factors, obviously, that trigger Graves can trigger thyroid eye disease, but so in your opinion, would you say that, I guess, would you agree?
Absolutely. Yeah, no, absolutely. But even though they may have the same triggers, I want to point out one really interesting just clinical pearl, I guess, is that thyroid eye, the thyroid condition, for example, whether it's Graves or Hashimoto's, and thyroid eye disease, even though they're caused by the same autoimmune process in the body, they don't always go in parallel. So, for example, what I mean by that is someone could have a history of Graves' disease, and it may have been a long time ago, let's say it was 20, 30 years ago, it was treated. Now, all of a sudden, they develop thyroid eye disease. And I've actually seen that in a handful of patients where they're completely quiet from the thyroid side, and decades later, all of a sudden, they develop thyroid eye disease. So in that situation, we really have to think about these triggers, these lifestyle triggers, modifiable triggers, exposures, et cetera. Why did they flare up? Or the opposite can happen. Sometimes they can have no history, no thyroid history whatsoever, and then all of a sudden start developing these unusual eye symptoms. They don't know what's going on, and then ultimately they get diagnosed with thyroid eye disease, and their thyroid seems to be fine. It's functioning fine. They're euthyroid, and then years, or again, maybe even a decade later, that's when they develop the clinical symptoms and signs of autoimmune thyroid disease. So they don't always go hand in hand in terms of the time frame. So, the reason I say it's a clinical pearl is because, we're going to be talking about some of the symptoms and signs of thyroid eye disease. If you do experience any of these, be sure to talk to your eye doctor and your primary doctor, and maybe get a referral to an endocrinologist, or vice versa. If you are seeing an endocrinologist, or you're being managed by your primary care doctor, and you start to have some of these eye symptoms, be sure to ask for a referral to go see an eye doctor, because it could be the onset of thyroid eye disease.
All right. Why don't we talk about some of the symptoms and signs? And also, I know I wanted to discuss like what happens when someone sees you for the first time, like the procedure. So I guess maybe start out by explaining why someone would see you. I mean, with thyroid eye disease, I imagine it's usually more moderate to severe cases when they're seeing you, because I know endocrinologists don't refer every
Mhm.
thyroid eye disease patients and ophthalmologists. And so like when would a patient usually see you or be referred to you? And then what's the routine when they initially see you for the first time?
Well, the majority of patients who actually get referred to me as a neuro-ophthalmologist, or they may be referred to an oculoplastic specialist who also deals with thyroid eye disease, is when the condition is really interfering with their function. So not just swelling of the lids or redness or dryness, but really if there are other issues that come into play. For example, vision loss. That's a big one. So if someone starts to have blurry vision, and they actually feel like their peripheral vision is somehow affected, maybe they have some patchy vision, or their central vision is affected, or if they start to have double vision, that's usually when they get referred to a neuro-ophthalmologist. And it's my opinion that those are the more, as you mentioned, the more moderate to severe cases. I think that even the earlier cases should be referred, because there are certain things that we can sometimes pick up on an exam that could help explain the patient's symptoms that perhaps their endocrinologist won't be able to necessarily pick up, or even their regular ophthalmologist may not be able to pick up. That these are very subtle things that either a neuro-ophthalmologist or an oculoplastic specialist can pick up. So what happens during an eye exam? This is a great question. So first of all, when patients come to see me, I tell them, block out half the day. You're going to be with me for anywhere from 2 to 4 hours. This is not your regular eye visit. We are doing a lot of testing, and we're really getting a good feel for, what's going on, what level are you at, what do we need to do to protect and preserve your vision. So first I do a very thorough intake. So I want to know not just their thyroid history, but their entire medical history. I want to know what medications they're on. I want to know their diet and lifestyle factors. That does take quite a bit of time to get all that information in the beginning. So usually it takes me about half an hour to 45 minutes to collect all of that preliminary information. And then we start with the exam. So of course, we check vision, we check distance near, we check color vision, check depth perception, because that's important, because that can be affected in thyroid. And then we do a test called a visual field test. And this is a challenging test to do. If any of you have ever taken it, you probably know what I'm talking about. You sit in a machine, and the machine's like a bowl, like a white bowl, and the machine is automated. It gives you little white dots. And when you see the dot, you're supposed to press a button. And so the machine is testing your entire visual field, meaning your peripheral vision. And this is very important for people with thyroid eye disease, because if there's a lot of congestion in the eye socket, their optic nerve may be compressed and they may have loss of peripheral vision. So this will pick up even the earliest stages of optic nerve compression. So that's important to do. And then I check alignment, which is how do the eyes work together? Are they aligned? Are they misaligned? For example, is one eye higher than the other? Is one eye crossed in? So it's a measurement that it's important, especially if someone has double vision, to do that alignment measurement. And then I check their proptosis, meaning are their eyes bulging within their eye socket? So there's a device that I use, and I wish I had one to show you, but basically it's like a little metal device that I put here on their bones, and I can measure how prominent their eyes are. And we do this at every visit. Then we check their eye pressure, which is really important because patients with thyroid eye disease can have elevated eye pressure. Some of them are at high risk for glaucoma, which is associated with elevated eye pressure. So it's important to do that. Then I check them under the microscope. So I check their surface to see if their eyes are dry. I check their glands within their eyelids. I check the front of the eye, their iris, their lens, and checking them for cataracts, etc. And then we dilate them. And then beyond that, beyond the dilation, so after I've checked the nerve and the retina, we do photographs of the back of the eye. This is very important for monitoring patients because if there's any change, we can pick them up on serial photographs. So we do regular photographs of the nerve and the retina, and then we do specialized high-resolution ultrasound pictures. And these ultrasound pictures tell us the health of the optic nerve, whether there's been any damage to the optic nerve or not, and we also do the retina. So all of that together takes, again, it's a long, lengthy exam, but it really gives me the full profile of what's going on with a patient with thyroid eye disease. And of course, I look at their labs. I forgot to mention that, but I definitely ask my patients to bring in their labs. And if they've had imaging, for example, if they've had a CAT scan or MRI before, I ask them to bring me their CD-ROM so that I can look at that and I can take a look at their eye socket, what's going on with their muscles, what's going on in the back of the eye socket, is there any compression of the optic nerve? So it's pretty extensive.
Yeah, I didn't realize how detailed it was that first visit. So, do they have to usually come back for a second visit to get the findings explained to them, or do they get most of the answers during the first visit?
I try to do everything at the first visit, and I give them, kind of a roadmap of what to expect. And then, depending on where they are, if they have very mild symptoms, I may say, okay, come back in 6 months or a year. If they have more advanced disease, then may have to see them much sooner. So, in severe cases, I may be following them, for example, every week or every 2 weeks. But in moderate cases, I may be seeing them like every 3 to 4 months or so. So it just depends on how they come in, how patients, where they are in the spectrum of thyroid eye disease.
You also mentioned that you check things such as pressures, just also to make sure they, don't have glaucoma. Are people with thyroid eye disease more susceptible to developing other conditions such as glaucoma, cataracts, even macular degeneration, which I think is more maybe age related, but you're the expert, so I want to, of
So
course, get your
glaucoma,
opinion.
definitely. And the reason is because if there's a lot of congestion in the eye socket, then the pressure in the eye can go up just from the congestion. And high eye pressure is a risk factor for glaucoma. So many people ask, what's a normal eye pressure? So normal eye pressure. Now, again, this is in a Caucasian population of mainly men that the studies were done, but normal eye pressure is anywhere from 10 to 21. Now, that being said, some people have pressures that are higher than 21 and it's normal for them. So just having an eye pressure that's higher than 21 does not mean that you automatically have glaucoma. We take the eye pressure in conjunction with the visual field test and the optic nerve appearance to determine if somebody has glaucoma. So that's why all of those tests are really important to really determine, okay, is it just an elevated eye pressure or is the elevated eye pressure putting someone at risk for damage to the optic nerve? But it is something really important that your eye doctor should check at every visit. It's kind of like a vital sign. When you go to the regular doctor, you get your blood pressure taken. When you go to the eye doctor, you get your eye pressure taken.
Makes sense. And with like cataracts and other eye diseases, eye conditions, are they more likely to, or it's mainly just
So
glaucoma?
fortunately, not that I've seen or not that I've heard about in the literature. Again, as you mentioned, those are conditions that can happen to anyone as people get older: cataracts, macular degeneration. The one condition that is very common in thyroid eye disease patients is dry eye. Dry eye can occur independently of thyroid eye disease, but it really can get exacerbated with thyroid eye disease. So that is something definitely that your ophthalmologist will check. And if you do have dry eye, definitely should be treated. So
Yeah,
that
I
that
was
is a
actually going
higher.
to ask you about that because you mentioned how you feel that everyone with thyroid eye disease, even the mild cases, should see a specialist. So even if they're suspecting that it might just be dry eyes, you think it's a good idea. Like, is it difficult to differentiate sometimes mild thyroid eye disease from just like a case of dry eyes, or?
So thyroid eye disease usually causes other congestion on the surface of the eye, and we can see that under the microscope. But then there are also lid changes that can happen. We didn't mention this earlier. It is part of the exam as well, is to look at the eyelids and see how the eyelids are resting on the eye. And in thyroid eye disease, many of your listeners may know that the eyes kind of start to open up, and this comes almost like a stare appearance, like the eyes are wide open, a deer in the headlights. And so that alone, because there are lid changes that happen where the muscles kind of get pulled and they get tight and restricted, that can also contribute to dryness of thyroid eye disease. And it definitely needs to be treated much more aggressively, because if the lids are wide open, let's say when someone's sleeping, their cornea is not lubricated, they are at higher risk for not just dryness of the eyes, but even a corneal ulcer. And this is something that is so easy to prevent as if it's diagnosed early enough. Of course, we don't want to let things go. So that's why I'm saying that even patients with milder forms of disease should see an ophthalmologist, at least for a baseline exam, to kind of see where they're at, see what they're most at risk for, and to address it before it becomes a real problem, before it becomes an ulcer, or you know even then the worst case scenario is an ulcer that's perforated. I mean, that's really a medical emergency. So we don't want things like that to happen. And I don't want to
Yeah,
scare anyone. That's the other thing. We're talking about all of these, potential things that can happen with thyroid eye disease, but some of these are really in the more advanced cases. We don't see this commonly, but of course, you would just want to be aware of them so that you can be an advocate for your own health. And if you do think that you have any of these things that I'm talking about, definitely talk to your eye doctor about it. Maybe get a referral to a neuro-ophthalmologist or oculoplastic specialist.
all right, great. Thanks for sharing that, Dr. Rani. And before we talk about some of the natural options and things that people could do in that active stage that we were discussing earlier, can you talk about some of the conventional treatment options? And I also want you to touch upon Topeza as well.
Absolutely. So if we'll talk about the traditional, the traditional therapies that have been used for the past, decades, 4 to 5 decades. So the first, the treatment, in terms of the order, the first thing we typically do is if someone is at risk for vision loss, we usually start with steroids. And steroids are not, for the milder cases. They are really reserved for the more advanced cases of thyroid eye disease. And we can give either IV steroids or oral steroids to help with the congestion in the eye socket. But steroids have lots of side effects, as many of your listeners may know. They're not ideal. And it's not something that we can really use long term. So, in terms of long term, there are other medications that can be used, immunosuppressive medications to try to modulate the immune response. Even radiation therapy has been used for thyroid eye disease. But the most exciting development in thyroid eye disease is really Topeza, which is teprotumumab. It's hard to pronounce, but Topeza is much easier to pronounce. But this is the first FDA-approved treatment for thyroid eye disease. Steroids, again, are used, but they're not officially FDA approved for thyroid eye disease. So this is Topeza is a biologic agent, and what it does is it targets a particular receptor that gets activated in thyroid eye disease. So it targets insulin-like growth factor and the receptor for that, and it prevents a lot of the release of some of the inflammatory modulators. It helps to improve congestion, puffiness, redness. It helps to reduce the size of the muscles in the back of the eye when they get inflamed. It can help reduce the proptosis, meaning the bulging of the eyes, and it can also help with double vision. So Topeza has really been, it really has changed the options for patients with thyroid eye disease. It is an infusion, so just so you're aware, it's an infusion that's given every 3 weeks for 8 treatments. So basically about 6 months of therapy. And usually within the first 2 to 3 months, patients notice a big improvement in their symptoms and signs in terms of the congestion and so forth. It may take a little bit longer to see some of the other benefits, for example, the double vision improvement, et cetera. But Tepezza is it's approved, but it is not easy for all people to get. And the reason is because there are very specific criteria that patients need to meet for their insurances to pay for the drug. Now, it is quite expensive. I don't know the exact amount of the cost of therapy. I believe it's well over $200,000 for that 6 months of therapy. And sometimes patients need a second round, 6 months or a year later. But that's why, in order for patients to qualify, they have to meet certain clinical indicators for active thyroid eye disease. So those are the typical standard treatment approaches. Of course, surgery is an approach which, as I mentioned earlier, we really reserve for the more advanced cases of thyroid eye disease. There are a couple of different surgeries that can be used. Decompression surgery is one of them, where some of the bone is removed, either from the bottom of the eye socket or the medial wall of the eye socket, and that lets the eye fall back into a more normal position. It helps with proptosis, with congestion. And then there can be separate surgery for double vision if somebody really has misaligned eyes, and after some time they're stable, their thyroid is stable, but their double vision is not getting better. There is a surgery that can be done to realign the eyes so people can see single again. And then there are obviously cosmetic procedures that can be done to put the lids back into a more normal position. So if the lids are wide open, there are surgeries that can be done to restore a normal lid positioning and improve cosmesis. So there's a lot of options out there. Not one option is right for everyone, or a combination of options is right for everyone. So you really should talk to your doctor about what is the best option for you.
So getting back to the Tepezza, so I know that it can have some dramatic effects when it comes to like the eye bulging, for example. I've had a few patients who had the Tepezza. With the double vision, you mentioned it takes longer, and I've seen that too, where it doesn't seem to, at least the first, someone's going through, I guess, the initial 8 infusions, doesn't seem to be as effective. Again, very small sample size on my part. You probably have seen a lot more patients who have received it. But as far as you've experienced, it can help with the double vision, but they
It
might need
can
another
exactly.
8 infusions.
So the patients I've seen who've had Tepezza, they've had it mainly for their congestion issues. But let's say they have double vision. If they have a big misalignment, let's say one eye is up here and one eye is here, it's possible that it could help to reduce it down. It may not exactly make it completely aligned. So it definitely helps to reduce the congestion, to reduce the number of, that we actually measure double vision in something called prism diopters. So it helps to improve the prism diopters. Patients may still need to have special type of glasses afterwards, like prism glasses, to help with any residual double, or ultimately they may end up needing surgery. But the clinical studies have shown that it does reduce the amount of double vision, maybe not eliminate it in all patients, but reduce that as well. So it is an indication for using Tepezza as well.
Okay. Thanks for sharing that as well. Any side effects people should be aware of when it comes to getting Tepezza?
Yes, yes. So there are side effects. They're considered mild, meaning not serious adverse effects, but they are adverse effects nonetheless. The most common ones I've seen are after the infusion, nausea, fatigue, some kind of like flu-like type symptoms that can happen. Some of the more concerning side effects I've seen, I've had some patients who've had some decreased hearing, and that appears to be temporary. Fortunately, that's not something long-term, but it is something that patients need to be aware of. Those are the main things. I know that in the studies that were published on using Tepezza, the studies excluded patients with diabetes. And I'm not sure exactly why they did that, but I have seen some changes in blood sugar with Topeza. It's anecdotal experience, but obviously the patient should be under the care of an endocrinologist as well if they do have coexisting diabetes to monitor that. Now, interestingly, there's also some reports of, and I don't know whether this has been published yet, but I've talked to some of my colleagues about this, people who've had Topeza. Patients who have thyroid eye disease sometimes have other changes in other parts of their body as well. For example, skin changes. And I have heard that Topeza has helped those changes as well. For example, people can get something called myxedema, which is kind of a thickening of the skin in their lower extremities, or like a change in their skin texture. So I've heard that anecdotally that Topeza may be able to help that as well, but that's not the real indication. The indication is eye disease.
All right. And can you discuss? I think there are alternatives if someone can't get Tepezza, correct? If, as you mentioned, the cost, but then in other countries it might not be available. So there are other biological agents.
Yes, the one that's most commonly used is something called Rituxan or rituximab, and that particular biologic agent has been around for a long time, and it's a CD20 inhibitor, so it's a type of B cell inhibitor. It's very specific, but it helps to modulate the immune system. And Rituxan is used for many other conditions as well. I've used it for many other autoimmune conditions as well, but that is more available in other countries. And it's, again, fairly safe. It's actually given less frequently. It's actually given as an infusion. You have one dose and you have a second dose within 2 weeks, but then after that, you have every 6 months you get an infusion. So it's every 6-month treatment, and it is indefinite treatment, not like Tepezza where it's 6 months and then you're done. It's actually indefinite treatment for basically every 6 months.
All righty. So let's go ahead and discuss the alternative options that people have with thyroid eye disease,
Mhm.
especially in that active stage.
Yeah, so absolutely. So I am a strong believer that you can do a lot through your nutrition and lifestyle choices to help improve your autoimmune condition. So this is very true for my patients with thyroid eye disease. So that my first intervention is diet. And first of all, I have them do a diet history and remove any pro-inflammatory foods that they have commonly. For example, initially, I do have them remove all gluten and dairy. And Dr. Ozansky, you probably do the same, I'm guessing, because we're
Yes.
trained very similarly in functional medicine. So, those are the two most common inflammatory foods that can trigger autoimmune disease. So I have them do that, and I usually tell them it's difficult to do this, but I really want you to try to stick with this diet for 3 months. And I know some doctors will say 3 weeks, but I actually tell them do it for 3 months, because in 3 weeks you'll hopefully decrease your IgG load. But the cells that create those IgGs, the T cells and the B cells, they live up to 3 months. So if you really want to reset your immune system, do it consistently for 3 months. And also, in my practice, I use a specific diet that was designed by the Institute for Functional Medicine called the Renew diet. And that diet is an autoimmune diet, and it actually has certain other foods that you're supposed to eliminate. The one class of foods I found most important for patients with thyroid eye disease to eliminate are nightshades. And I don't know whether you have a similar experience with this as well in your practice, but I do have quite a few patients who, once they eliminate things like tomatoes and potatoes and eggplant and peppers, then they start to stabilize. And if they accidentally have a little bit of it, they know immediately, oh my goodness, my thyroid eye disease is flaring up. So they know that their body is reacting to some compounds in those nightshades. So I know it's quite difficult to do because some of these foods are, these vegetables and fruits are so pervasive in our foods that we eat. They're so commonly eaten, and most of us love these foods, but it is really important to see if you are one of those people that reacts to nightshades. If you have thyroid eye disease, do a trial, eliminate it for, if you can, not just a couple of weeks, but even up to a couple of months, and see how you respond to that. So that's usually my first line of treatment. I also use supplements and botanicals. So in terms of supplements, I think the most important things are the anti-inflammatory supplements like omega-3s, vitamin D, and then curcumin, which is turmeric, which you can have either as a spice with your food or you can take it as a supplement. Those are my top three for thyroid eye disease. And of course, selenium. I didn't mention that, but there are studies that have shown that selenium supplementation at 100 micrograms twice a day can be there's a European study that showed that it can be useful in thyroid eye disease, but it can take some time to work. So don't expect an immediate response. I have some patients who take it for a month or two and they say, oh, it didn't really do anything, so I stopped taking it. But I tell them you really have to take it for a good 3 to 6 months to really start to see the benefits.
Yeah, I do agree with the nightshades, about the nightshades. I do have people, my patients, stop eating the nightshades as well. And I also agree with the omega-3s, vitamin D, selenium, and yeah, turmeric, curcumin could definitely help with inflammation. How about glutathione? Now, selenium, of course, that's a cofactor for glutathione, but do you find like taking NAC or liposomal glutathione to be beneficial at times?
So it's not my first line of therapy, but those agents, all those three actually, glutathione, NAC, and alpha lipoic acid. That was the third one that I was going to mention. Those are all very potent antioxidants made by our bodies, but we also can take them as supplements. And so in cases where patients are not responding, or if they continue to have worsening disease, then I may add one or two of those into the regimen. But they definitely are good for overall health. I mean, they're antioxidants, and they really can help fight inflammation. But again, it's not my first line of therapy.
Okay. And being a functional medicine practitioner as well, I assume you also agree that it's important to optimize the health of the gut because you need in order to have a healthy immune system, you need to have a healthy gut.
Absolutely, yes. So the gut is kind of the cornerstone of functional medicine therapy. You want to promote gut health because in our gut resides a lot of our immune system. And so if you can decrease the activation of our immune system through the gut and promoting a good gut microbiome, healthy gut microbiome, you can decrease the immune system's predisposition to getting ramped up and cause autoimmune disease. So I recommend that patients have probiotics in their diet, live probiotics, prebiotics, but also perhaps take a supplement as well. And when I do recommend supplementation with a probiotic, I recommend cycling through it. So not just to take the same probiotic all the time, but maybe every week or every 2 weeks to cycle through 2 or 3 different brands, different strains of probiotics that you're taking. And of course, make sure that you're getting them in your diet as well. Lots of probiotic foods, of fermented foods, which, on the flip side, can sometimes maybe trigger an autoimmune response in some patients. So you really have to see how your body's going to react to that in terms of live probiotic foods. I don't know what your experience has been with patients with autoimmune thyroid disease and maybe even thyroid eye disease, but you really have to be kind of a detective and find out if your body's going to react to something or not.
Yeah, definitely agree with that. How about stress, the impact of stress, the role of stress management, as well as getting proper sleep?
So important. And these are just basic foundations of health that, I just have to keep emphasizing to my patients, like, okay, how are you doing with your stress? What are you doing for stress relief? We all have stress in our lives. That's a normal part of our lives, but we have to learn to modulate that stress. I'll give you a perfect example of a patient of mine. So this was a woman I started seeing over a year ago, and she developed thyroid eye disease during the pandemic. So she was completely fine, and all of a sudden she had horrible swelling, double vision, dryness, etc. And it turned out that during that time, during lockdown, her daughter had come to live with her. And so they were living together and they had a lot of friction between the two of them. And, she was constantly fighting with her daughter and this, she believes, really triggered her stress. And it's unfortunate that this happened. But then she actually made a decision to go visit her son who lives out of state. So she went to go visit her son for 6 months. And of course, obviously, it was also a change in climate because she moved from New York to New Mexico for 6 months. But in doing that, she was able to really improve her stress level. She was exercising regularly in addition to that. She was eating the right foods. She was on the Renew diet plan that I was mentioning earlier. She was taking the supplements. And in doing that, she was really able to put her body into a different state that was less inflammatory, so that when she came back to New York and she was back with her daughter, she was able to manage it better. So she really attributes, this sudden onset or development of thyroid eye disease to the stress in her life, both from COVID as well as from her home situation. But she was able to modulate that. So just as an example of how stress can impact us, and little things that we can do to manage it are really important. Sleep is really important too. So I had another patient who I've been seeing for a very long time. She's actually a judge. And so she has a very demanding schedule, a lot of stress in her life. And she was barely sleeping. She was sleeping maybe 4 or 5 hours a night. And, that was really impacting her health. And then when I talked to her about that, what are the things you can do to manage your stress? So once she improved her sleep regimen, her habits, her sleep hygiene, she also started to meditate. And that made all the difference for her in terms of just being more at peace, more at ease in her stressful job, and also just, just over her overall health improved as well. So she had been on blood pressure medications. She was able to reduce her dose of her blood pressure medication. So all of these lifestyle factors can improve, again, not just your thyroid status and your thyroid eye disease, but perhaps many other aspects of your health as well.
Well, thank you so much for sharing those examples. And of course, thank you so much for sharing everything. I imagine anyone who has thyroid eye disease has found this to be really helpful. And before we wrap things up, a few things that I want to mention. So, first of all, Dr. Rani and we had a master class earlier this year. So,
Yes.
in the show notes, I am going to include a link to that. And it's if you want even more information on how to improve your health when dealing with thyroid eye disease, that's something you might want to check out. And again, in the show notes, I'll include the link. And also by listening, you could also get 50% off.
Yes.
And there's a code that you will need to enter. So I will put that also in the show notes. Just make sure you enter that code to get the 50% off. And also, Dr. Rani's coming out with some books. So we're recording this in December of 2021, but in 2022, you're coming out with not one, but two books is the plan, correct?
Yes, yes. So I've been working on these books for the past 3 years. It's taken a while to come to fruition, but I'm really excited about them. One book is called Best Foods for Eye Health A to Z. And in this book, I go through all the nutrients we need for our eyes, for everything, for dry eye, prevention of dry eye, prevention of cataract, glaucoma, macular degeneration. And so I go through the nutrients we need, and then the foods that supply those nutrients, and I have recipes in there as well. And the second book is a book on macular degeneration. And macular degeneration is very near and dear to my heart. I see a lot of patients with macular degeneration. And I myself, I'm at risk for macular degeneration because I have a gene for it. And I'm going to do everything I can to prevent vision loss. And that's through nutrition and lifestyle. So my book addresses functional integrative approaches that you can use, practical tips you can use to decrease your risk for macular degeneration. So thank you for that, Dr. Eric. Thank you for letting me share that.
Yeah, you're very welcome. And I assume they could just visit Amazon to
Yes, when
purchase
they're
that when it
out,
comes out.
they'll be on Amazon. They'll be in Barnes and Noble. So, or you can visit my website, and then you can find the links to purchase the books. But I'm
Yeah,
very excited because this is something it's really, if any of you have taken on a project like writing a book, it is a long journey, and so this is something I've
definitely.
poured my heart into. So I'm really excited about both of these projects.
Yeah, as an author myself, I'm excited for you as well, and can't wait to read them. And yeah, so your website also. So can you tell? I'll also include your website in the show notes, but can you also mention it here too?
Sure. It's my full name. So it's www.rudranibanikmd.com. So it is long, but it'll be in the show notes. And through there, you can find out a lot of, I have a lot of blogs on my website. I talk about all kinds of eye health topics. And I also, as a neuro-ophthalmologist, I also treat a lot of migraines. So you can find a lot of hopefully helpful information on migraine through my website.
All right, wonderful, wonderful. Well, thank you. Thanks again, Dr. Rani. As usual, it was great chatting with you again. And as I mentioned, I'm sure those with thyroid eye disease, even people without thyroid eye disease, because again, a lot of what we mentioned also could help people with other autoimmune conditions too, just talking about some of the supplements and gut health, but especially those with thyroid eye disease, the specific topics, it's the Topeza and the two stages. So I'm sure everyone with thyroid eye disease definitely found this to be valuable. And again, thank you again for joining me here.
It was my pleasure. Thank you so much.